Hello, I am Dr. Sandeep Salvi, the Director of the Chest Research Foundation situated in Pune. I am going to share with you some of the latest knowledge we have about the burden of asthma in India. Asthma is one of the most common ailments that a doctor encounters in clinical practice. The Global Burden of Disease 2016 report was just published in September 2018 in the Lancet Global Health. And the data that I'm going to share with you is the latest one that we have about the burden of asthma in India. Globally, an estimated 340 million people suffer with asthma, of which India has around 38 million, which means that 11% of all the asthmatics in the world live in India. India ranks number 2 in the world in terms of the total number of cases of asthma. But what is something that is really worrying is the fact that India contributes to 40% of all the asthma deaths. To be precise, 43.6%. Of all the 420,000 deaths that occur in the world, 40% of these occur in India. India is the country that has the most number of asthma deaths. Disability adjusted life years, which is a combination of deaths and prevalence, is also high in India. And India ranks number 1 in the world in terms of disability adjusted life years for asthma. So clearly, asthma is a big problem in India, and more worrying is the fact that more people die due to asthma in India than any other country in the world. So here is a slide that shows you the burden of asthma over a period of time, and you can see that the last point on the x-axis is the year 2016. India is number 2 in the world when it comes to the total number of asthma cases, very close to China. And I would not be surprised if India overtakes China for the burden of asthma in the next few years. The top 5 countries in the world that have high burden of asthma include China, India, Indonesia, the United States, Brazil, and so on. When you look at the deaths due to asthma in the world, India is right at the top, and I did tell you that 43% of all asthma deaths occur in India. All the other countries are way below that. This is the slide that shows you the absolute numbers of asthma across the different states in India, and you can see that this is the number of asthma cases irrespective of the population of the state. So obviously those states that have a high population will have high numbers of cases of asthma. So if you look at it from that perspective, Uttar Pradesh is a state in India that has the most number of asthma cases, followed by West Bengal, Maharashtra, Bihar, and Rajasthan. But when you correct it for the population, so the total number of asthma cases per 100,000 population, then you start seeing a little different picture. Sikkim, Tripura, Nagaland are the 3 states that have very high burden of asthma if you correct it for the population, followed by Kerala and Andhra Pradesh. This is the state-wise deaths due to asthma in India adjusted for the population. And very interestingly, you can see that Rajasthan is the state in India that has the most number of asthma deaths, followed by Uttar Pradesh, Uttarakhand, Assam, and Haryana. So these are the states that have very high burden of asthma deaths. A few years ago, I was a part of this global study called as the Asthma Insights and Management Study. This study was conducted in 20 different countries across the world that included the United States, Europe, Canada, Latin America, and the Asia Pacific region. 9 countries were included in the Asia Pacific region, of which India was one of the 9 countries. When we compared the suffering due to asthma across all these countries, you can see that India is right at the top when it comes to number of patients who report nighttime symptoms on a regular basis. You can see that IN, which represents India, is right at the top. The figure that is next to that describes the overall asthma control in people who live in different parts of the world, and you can see that India is right at the bottom when it comes to treating our asthma patients well. So what are the carry home messages that I would like you to take from my presentation? Indian asthmatics suffer the most in the world and have the highest death rates. We as doctors need to start worrying about it, because if we have to reduce the burden of asthma and the number of deaths that occur due to asthma in India, we have to improve the quality of care that we offer to these patients. Physicians, pediatricians and general practitioners have to play a big role in not only diagnosing these cases but even treating them in the best possible manner, so that we can certainly reduce the burden due to asthma in our country. I am going to share with you some of the latest information we have about the burden of COPD in India. According to the latest report published in the Lancet Global Health in the September issue, we have all the information about the latest burden of COPD. As you can see, globally there are 251 million cases of COPD, of which 55 million reside in India. That means India contributes to around 22% of all the COPD cases in the world, and it ranks number 1 in terms of the total number of COPD cases in any country. India ranks number 2 in the world when it comes to the number of COPD deaths, and number 1 when it comes to disability adjusted life years due to COPD. So this is a snapshot of the burden of COPD in India. In this slide you can see the time trends of the burden of COPD not only in India but other countries of the world, and you can see that until very recently China was the country that had the most number of COPD cases. India has now overtaken China in the year 2015, and as I said, there are an estimated 55 million cases of COPD in India. When you look at the number of COPD deaths, China is the country that has the most number of deaths, but these are suddenly dropping since the year 2002. But India, I think, seems to be going a little in the other direction. The deaths due to COPD in India are increasing, and perhaps in a year or two, we will become the first country in the world to have the most number of COPD deaths. If you look at the change in the prevalence of COPD in India from 1990 to 2016, you can see that the different states have got a different color. That's the heat map that shows you the heterogeneous spread of COPD burden across the different states in India. What is important to note is that the colors have changed in 2016, which means that the burden of COPD has increased in almost all the states in India over the last 25 years. COPD is the second leading cause of death in India and the second leading cause of disability adjusted life years. You can see that the states that have the highest burden of COPD in India are Jammu and Kashmir, Himachal Pradesh, Uttarakhand, Haryana and Kerala in the south. So these are the states that have the highest burden of COPD. When you look at the number of deaths due to COPD in different states across India, you can see that Rajasthan is the state that tops the list, followed by Uttarakhand, Himachal Pradesh, Uttar Pradesh and Haryana. So essentially all the northern states of India have a very high death rate due to COPD. You can appreciate from this fact that not all COPD in India is because of tobacco smoking. In fact, tobacco smoking contributes to only about 20% of the population attributable risk for COPD, with about more than 50% of the risk coming from ambient air pollution and household air pollution. So air pollution is a bigger risk factor for COPD according to this latest report. Different states have different risk factors associated with COPD, and as you can see that some of these states have high risk factors associated with tobacco smoking, some states have low risk factors associated with tobacco smoking, whereas other states have household air pollution as the bigger risk factor. You can see the different color codes over here that describe this. So what are the carry home messages that I would like you to take from this presentation? COPD is the second leading cause of death in India. It is the most common chronic respiratory disease that we see in clinical practice. The burden is increasing, and I think it will keep on increasing for the next 2 to 3 decades. Over 80% of COPD in India is associated with non-tobacco smoking related risk factors, which is very different from what happens in the Western world. Unfortunately, COPD remains very poorly treated in India. Thank you.